neuromuscular problem, but as I say, I'm privileged to have worked with lots of people. So I will start by sharing my screen. So hopefully this will work. Okay, can you see that? Okay. Okay. I'm just wondering if I can get rid of the pictures, because there we go. Okay, so I'm going to start off by thinking about what it's like to be a psychologist and how that is something that can be helpful to other people. So psychologists basically are trained to look at how people develop psychologically, so cognitively and psychologically, and how people react to different situations or to different life experiences, and to learn what is typical for most people. And often people with neuromuscular conditions can have a typical response to something that's not typical for everyone, and it's really quite stressful for people. So psychologists are also trained to look at what is sort of normal for people who've got a neuromuscular problem or any other thing. So we'll look at experiences that people have. We'll look at how we can help people adjust to those situations. So we'll do an assessment, a formulation, and then figure out an intervention. And unlike psychiatrists, we don't prescribe medication. So I just thought it was useful to clarify that first. And also, you probably thought, there's different kinds of therapists, different psychologists. So clinical psychologists are basically trained in a range of different sorts of interventions or different types of therapy, unlike therapists and counsellors who usually have one type of therapy that they use particularly. So if you know exactly what kind of therapy you want, it's quite helpful to go straight to a therapist, whereas if you've got a problem where you think actually CBT or something like that isn't necessarily going to help me in my situation, it can kind of be quite useful to see somebody who's more sort of trained in lots of different therapies. And as I say, psychiatrists are medically trained and can prescribe drugs. So if it's helpful as a psychologist for me to have somebody see somebody for their mental health issues, I can refer to a psychiatrist as well. So you've probably all seen this picture before. So the question is, what are you seeing? So most people would say it's a glass and it's either half full or half empty. But again, it's not just half full or half empty, is it? How heavy is that glass? And I think basically, if you think about it, the absolute weight of the glass doesn't matter, but it's about how long you hold it for that does. So if I held it for a minute, it's not really a problem. If I hold it for an hour, my arm's going to ache a bit. If I hold it for a day, my arm might feel quite numb or paralyzed. But in each case, the weight doesn't change. It's just the fact that it feels heavier because you've been holding it for a long time. So the stresses and strains of life are a little bit like that glass of water. And if you think about them for a while, nothing really happens. If you hold on to them for a little bit longer, they start to hurt. And then if you hold them for a really long time, you can feel paralyzed or incapacitated to do anything or incapable of doing anything. So living with a neuromuscular condition can sometimes feel like that. So I thought what we do today is think about some ways we can kind of maybe alleviate that a little bit. So the things that we're going to talk about today, what's typical? What's it like having, what are the issues you need to think about when you've got a neuromuscular condition? And then start to think about, well, is it my condition that's changed or is it my thinking that's changed? So it's really helpful to kind of make a distinction between those, even though there could be an overlap. And then when might I need some help? And one of the common questions I often get asked is like, will things improve? Well, if you get the right help, it's possible to change things. And then finally, we're going to think about where you can get some help from. So when you think about health, we actually think about health in a sort of a biopsychosocial situation. So it isn't something that's on its own. So everything overlaps in life, doesn't it? We're not an island. So we have our biological slant. So you think about gender, physical illness, disabilities, vulnerability, and all those different things that happen inside of our bodies. Then you have the psychological side of things, which is like thinking about memory, attitudes, personality, behaviors and emotions, coping with trauma, and what coping skills we've all got. And in society, we're actually really part of society as well. So there are all those different things that will affect us as well. So social support, family background, cultural traditions, socioeconomic status and education. So as you can see, health is in the middle of all of that, and they all overlap. So as a psychologist, that is something that is really specific to me, thinking about all those areas. And I work in a person-centered way. So we look at each individual as a person in their own right. So what is typical? So everybody, regardless of whether you've got a neuromuscular condition or not, will feel things are difficult at times, and that's normal, and it's really normal for everybody to feel a range of emotions. And if you don't feel a range of emotions, that's quite unusual. So as we know, mood can fluctuate over time, and it responds differently to different events, situations, to our health, and to other people. So often we kind of compare ourselves to other people, so it's not necessarily always helpful. So what we need to think about is, is it the same or different to other people? And actually what we need to really think about, is it the same for me, and what's my normal? Okay, so when thinking about neuromuscular conditions, so we also see the scales there. So we can think, actually, physically, we know there's an issue with our physical demeanor, but also, that can impact on our mental health. And I think what we need to think about is, things can be a mixture of those, but actually it's at times when things get out of balance where things become really difficult. So if your mental health is more of an issue, you might focus on that. Or if your physical health has deteriorated, you might focus on that. So the question to be asking is, what are you focusing on? And that can have a really big impact on what's actually going on for you. So as you'll see, with the neuromuscular condition, there's lots of things. So we can, if you feel that you've deteriorated, or your breathing is more difficult, or your balance isn't great, you focus on the neuromuscular symptoms. But also you've got a brain, so you might start thinking, actually, what's going on? I'm really worried about this. And then you start to have to think, well, actually, is it my thinking that's changed, or is it my neuromuscular problem that's changed? And quite often I'll talk to people about that, because if you're struggling psychologically, you might be focused on some more of those things where actually your coping capacity has changed rather than your neuromuscular condition. Okay, so as you see from this picture, we've got the nice furry little pink person who is in that pink sort of sphere. You can see where it says self, society, and neuromuscular issues. And that's where we want people to be. We want the self to be a bigger part of that picture. Society will stay the same, and the neuromuscular condition will be part of that person, but not the whole focus. And as you'll see on the opposite side of the screen, we've got a little person, and we've got neuromuscular issues being big and green. And that's what happens when things get out of balance, and we start to focus more on the neuromuscular issues rather than ourselves, and then we become very small. So what, as a psychologist, I aim to do is to try and bring that person back to being that big pink circle rather than the little tiny one on the opposite side of the screen. So then thinking about, what is it? Why? When might you need some help? So there's lots of times when things get quite difficult, and some of these can be thinking about, going through what's going on, or you're trying to investigate what's happening. That's quite difficult. You might be passed around quite a lot. Then you get to the point where you get an investigations done. Again, that's quite difficult. A diagnosis, taking on board all the information you might have to learn about, and then post-diagnosis, when it all starts to sink in, what's going on for you. And then there might be things like times of adjustment. So you may lose some function, or you might have to start treatment. And then managing deterioration. And then thinking about transition, because if you're a teenager moving into the adult realm, again, there might be things that are different there. You might have some losses in terms of support. And then bereavement. These are familial conditions quite often. So it might be that somebody in the family has lost function or passed away or something like that. So there might be different times when you need some help. And what might help look like? So the different sorts of support that you might get, we've got emotional support, which is a general kind of informal support that a lot of people have. It can be done anywhere by most people, and it can help with a range of feelings. And it's not necessarily viewed as anything different from social support. And most people give that kind of support from time to time, whether it's friends, family, or whoever. Whereas psychological support is something that's more structured, and it's basically given by somebody who's had a lot of training, and there's a cost to it, whether it's to the NHS or to the person themselves, but it's it's a different thing to psychological support, to emotional support. So exactly as I've just said, that there might be different times when we need help. So there's certain things you can kind of look out for in terms of how you're feeling to decide whether you might need some help or not. So things like if you're feeling more emotional, if you're getting a bit more argumentative, or you're getting a bit angry or tearful. Some people eat or drink more or less, or might use drugs. You might have thought, well, actually, I've tried some self-help techniques, but they're not really working, and I don't really know what to do next. And things like if you're isolating yourself and you not doing the things you used to, that's when you see that sort of self shrinking a bit. So that's something to think about. And if you've been feeling low for more than 3 months or start feeling suicidal, those are the times you need some help. So the questions you have to kind of ask yourself are, what have you or other people noticed? What things have you stopped doing? And what have you done to help yourself? So if you can kind of answer all those questions, that gives you an idea of whether you need some help or not. And then thinking about, are you living or existing? So if you're living, you're doing all the things you want to do, you're involved in your own life, you make some decisions for yourself, you're not letting negative emotions completely take over your world, you're doing things that make you happy and you're looking forward to things, and you're making decisions about your own life, as opposed to existing, where you feel like everything's out of your control, your emotions are getting worse, you're just seeing the negatives in everything, you're not doing things, you kind of stayed in the same situation that's made you unhappy, or you're bored and stuff like that, or you're just doing the same routines over and over and over again, and you don't feel like you've got any sort of decision making, everybody else is making decisions for you. And as we know, like, making changes can be really hard, and it takes a lot of effort. So things might often get worse before they get better, and that's often what happens if you have psychology. You have to address all those negative things that are happening for you and try and find a path. But one of the questions I ask as a psychologist is, are you ready to make that change? And that is the real question, because in order to actually make some changes, you have to be committed. And I think the next slide is, I'm going to ask Nina if she can share a little video for you, because this talks about the different stages of being ready to make some changes. So if Nina could share a screen for me here, that'd be great.
Sorry, I am looking for it right now.
Okay. Do I need to stop sharing?
I think I've stopped you sharing, but for some reason it's disappeared off my list. Let me just do one thing. There you go, and that should do it. My apologies. I've got Bernie's story.
No, it's the other one.
The other one, yeah. There we are. Would you like me to start the video?
Yes, please.
The stages of change model, also known as the trans-theoretical model, has been found to be an effective aid in understanding how people go through a change in behavior, like losing weight or quitting cigarettes. The model was formed in the late 1970s by researchers James Prochaska and Carla Di Clemente, and has 6 distinct stages. Phase 1 is pre-contemplation. Here, a person is not considering change at all. They may even be in denial of a problem. Phase 2 is contemplation, when a person becomes more aware of the benefits, but also the costs. Phase 3 is preparation. A person in this phase might experiment with small changes and begin to prepare for larger life changes ahead. Phase 4 is action. Here, a person begins to take direct action in order to accomplish their goals. Phase 5 is maintenance, where they successfully avoid former behaviors and keep up new ones. And the final phase 6 is relapse. This is a common occurrence in any type of behavior change and can cause a person to experience feelings of failure and disappointment. While relapses can be difficult, the best solution is to start again without being too hard on yourself. Making a change in your behavior and making it stick is not always an easy task. The key to success is to not let setbacks undermine your self-confidence. Remember that change occurs gradually, and relapses are an inevitable part of the process.
Thank you. Okay, so I'll share again. Just need to get back. Yep. 3. Oh, I've lost my cursor. Okay. Okay, so you can see that again, yeah? Is that okay? Okay, so as you'll see from the video, it's quite difficult sometimes to be able to make a change, and I think often people need some work psychologically to be able to kind of get to the point where they're ready to change. And that's part of my job as a psychologist sometimes, is to work with people. So for example, I've worked with various people in the past thinking, for example, if you needed to use a walking stick, and quite a lot of people will actually fight against the idea of actually thinking they're going to use a walking stick. So I might do a piece of work with them to think, well, actually, what are the benefits of using a walking stick? Or, you know, what happens if you don't use that? It's okay to not use it, but what are the negative implications of not using that? So again, it's useful just to see that cycle, because, you know, being able to make a change, as you say, it's quite difficult, but you have to be in the right frame of mind to actually make anything work. And we can't change people's thinking, but we can help them get to a point where they can make a change. And often we get stuck in this way of thinking, in a thinking trap that, oh, I used to be able to do this before, or, you know, when I was younger, I could do this. But actually, if we kind of get stuck with that thinking, it's really difficult to make changes. So what we have to do is say, well, actually, you know, we can only work with what we've got now, and we can learn from the past, but actually we have to kind of just think, actually, how can we move forwards? So, as I said before, one of the things that we talk about is, will things improve? And though physically it might be difficult and you may have some deterioration, psychologically it's still possible to make improvements. And I think the more psychological improvements you can make, the bigger your world can become, because we know that, you know, if you disengage with society, your life becomes very dull and you're very isolated and quite lonely. So what we need to do is say, well, actually, you know, physically, the things we can do, we can help you with orthotics or aids and adaptations. But actually, the more we get you to re-engage with society, the better your quality of life will be. And sometimes, again, with research, we can do drug trials or physiotherapy trials, and that might stabilise a person's well-being too. So there are always times when things get harder, but that's life. But knowing how to manage it is the key to this. And often people will say, oh, you know, stop being horrible to yourself. It's really, you know, if you're arguing with yourself all the time, you know, the only person who tells you you're a bad person or you're not going to do very well can be you. And I think the key thing to remember is be nice to yourself, because it's really hard to be happy when you're being mean to yourself all the time. And often I have conversations with people about that. So we then start thinking about self-care. People often worry about doing things for themselves, or, you know, looking after themselves, and they say, oh yeah, but it's selfish, you know, I need to do all these other things and look after everyone else. And it's a little bit like if you're on a plane and they say, put your oxygen mask on first before you help anybody else. Because if you've got children and you put it onto them first, if you were to pass out, you wouldn't be able to help them, would you? So it's about looking after yourself before you can help others as well. So thinking about some of those things, like, you know, asking for help is the main key here. You know, if you need to do other things, you know, spend time on your own, setting boundaries, saying no, and forgiving yourself is another really important thing. And that's part of accepting help and moving forwards. So where can I actually go for some help? So self-help is always a really good thing to do, and it's a really good place to start. You've probably got loads of good advice to give to someone else. So basically, you know, it's about learning to take your own advice. So family and friends are also another good source of, you know, help, support. And if your friends and family aren't able to help you, there are voluntary organisations. And then obviously you've got the NHS. So you can go to your GP. If you're lucky enough to be in a neuromuscular team where there are people to help, so psychologists or specialist nurses or care advisors, go to them. And then physiotherapists, counsellors, or anybody who can offer you help, really. And I've got some links a little bit later on. So just as a quick sort of summary of what psychologists can help with, not everybody is going to need a psychologist all of the time, and I often find that people dip in and dip out of using psychology. So when there's a change, they might need some extra help, but when things stabilize again, it's, you know, people feel that they can manage, and they've learned some new techniques and skills to actually manage their life going forwards. And then again, when there's a change, they might need a little bit of a top-up session. So there's just a little list there of things that, you know, I see people for or help them with. So it could be things like, you know, come to terms with a diagnosis, having to, you know, attend lots of hospital appointments, struggling with mood, worrying about, you know, becoming worse. A lot of people have anxiety or, you know, problems with procedures, eating issues, difficulties with chronic pain and fatigue is a big thing that I help people with. And all of these things can have a massive impact on your mood, and they can all increase your stress. So managing stress becomes something that's really important. And actually, if we know how to manage stress better, we can kind of deal with some of those things better as well. So like I said before, you know, it could be that your neuromuscular problem has stayed the same, but your capacity to manage things has changed a little bit. So you're not managing things quite as well as you used to. Okay, so one of the main things, I think this slide is really important, and it's saying, learn to accept help, don't fight it, and try and make things easier for yourself. And, you know, we all try and fight things at times, but eventually we realise that actually we're just fighting ourselves. So being able to accept help or using equipment and stuff doesn't make people disabled, but actually not embracing the help and support and things that are out there can actually make you more disabled and, you know, isolate you from society. So I think as a psychologist as well, some of that is I have to help people acknowledge that they need to make a change, however difficult that is. And actually, if you need to use a wheelchair, or if you need to use a walking stick, or if you just need to talk to somebody about anything, you know, your mental health or your anxieties or whatever, accepting help is a really big step, and helping people along that journey is a psychologist's job. So the help that psychologists can offer, we do talking therapies, and we try and help people understand their feelings and problems better, and we try to manage these by reducing stress and adjusting to a new normal. So we'll carry out an assessment. With that information, we'll provide a formulation of the problem and how it happened, and we'll try and talk with the person about what interventions might help you reach your goals of making a change. And that can vary, and it can be, you know, a number of different things that we work on at one time. So psychologists aren't medically trained, like I said before, to give drugs, but if we feel that somebody's mood is particularly low, we might suggest that they need to see a doctor first to get some medication to help them move forward to engage with the psychological therapies. So that's not unusual, and I think it's really important to kind of make that distinction. So there are lots of warning signs we can recognise when we know that we need some help. So things that we've noticed were behavioural changes like lateness, not completing tasks, being disorganised, forgetting things, because cognitively your head's full of stuff, so it's more difficult to process stuff, and people really worry about forgetting things. And, you know, that was one of the things I often talk about. Reduced motivation, avoidance and acting out or aggression. And on emotions, we think about being irritable, being anxious, being upset, feeling panicky and all that kind of stuff, feeling overwhelmed, fed up, angry or depressed. And then, you know, not only are the emotions and behaviours something physiologically, you know, that can have a massive impact on how we feel and our stress levels. So thinking about, you know, you're not eating well, your sleep's disturbed, you're feeling you're more ill, you know, you get more bugs and things, you've got headaches, or you're tired all the time, and you might have physiological effects of a panic attack, for example. But all of that is also mixed up in our thinking. So we might get intrusive thoughts, our mind might race, have distorted thinking, or we might just kind of focus on something all the time, just one issue. And the more you focus on things, the bigger they get. And then the more we focus on something, our concentration becomes quite poor. So that will affect a whole load of things. So at that point in time, we often find that we're reaching some strategies that become counterproductive after a time, and though they might feel helpful to start off with, you know, over a period of time they become really unhelpful. Like, so you might start thinking, oh, I'll have a glass of wine to help me relax, but actually that might lead to, you know, being dependent on alcohol. You might use too many, like if you're in pain, you might use too many prescription drugs. People might smoke. People might stop picking fights with people, not physical fights, but obviously, you know, arguments, you know, might become more argumentative. Or you might just ignore the issues and bury your head in the sand and not do anything about it, and then it's just going to get bigger. Some people eat more or eat less, or people spend a lot of time alone and avoid things that they used to enjoy. So those are things to look out for. So thinking about what kind of things cause people stress. Well, if we put those into sort of two different categories, we've got all the external causes of stress, like thinking about going to hospitals, that's a constant reminder of your health. You might have some major life changes, relationship difficulties. You might find you've got financial problems, and the financial crisis recently has just been a bit of a nightmare for everyone, really. And then other things like being really, really busy, not having time for yourself, having to manage family and children. PIP is another big sort of stressor, and they've worked a lot with a lot of people who've really struggled to complete the forms because we know how difficult they are, and people have to acknowledge they've got lots of different issues or problems that they struggle with, and no one likes to see themselves in that kind of light where you're feeling, you know, bad about yourself. You want to show your best side, but PIP doesn't allow you to do that. And then people often worry that, you know, I'm not saying how things are properly, and then people don't get it. And so it's a big sort of thing where people really, really worry about PIP. Or work's another issue, you know, even something like in the winter, trying to get to work in the morning when it's really icy outside, when you're really, really worried about getting from the car to work, or, you know, you can't cope, you've got too much going on and you need to reduce your hours. So there might be things like that that really become very stressful for you. Or then we've got the internal causes. and things like inability to accept uncertainty. You know, it's really difficult to manage things when you don't know what's happening. We become very pessimistic, and we can talk to ourselves in a really negative way, and then we start believing some of those negative thoughts. We have unrealistic expectations of ourselves, and we can become perfectionists, or we lack assertiveness, and you just keep taking things on, and you think, oh, I haven't got the capacity for that, but I'm saying yes anyway. And then worry, people constantly worry, and the more you worry, the lower your self-esteem becomes, and that can really feed into how you feel about yourself. So as a psychologist, we often look at changing people's thinking, and we know that if you do the same old things, you get the same old results. So as a psychologist, that's a really, really important thing to think about. And often we talk about unhelpful thinking habits, and there's a few here on this page. So you might filter out anything that's positive and you see the negative things, or you might make judgments about others, and so you might make judgments that aren't really realistic. Or you might think, oh, I'm going to mind read, and you usually think you know what people are thinking about you, and that's not necessarily true. Or things like, you know, you think you can predict what's going to happen in the future, and it's always negative. Or you might make mountains out of molehills, or compare yourself to others. So often you'll see people having a great time, and there you'll go, well, my life's terrible and I can't cope. Or, you know, catastrophizing. We often talk about, you know, people thinking everything that's going to happen is always going to be bad, and so that's, you know, it's the worst possible thing that's going to happen, and that's not necessarily true. And then we can become really, really critical of ourselves, and so we'll always put ourselves down, and you have that negative self-talk all the time. And another one we talk about is black and white thinking, and as psychologists, it's really important to kind of get people into the middle, so you're not too extreme. So it's not, there's a big grey area in the middle, and we need to move people back into that kind of area. So those are the sorts of things, thinking traps that we get stuck in. And so as a psychologist, those are some of the things we have to kind of manage for people. And these cogs here give examples of some of the things that happen when you say, for example, you've got a low mood, you might do less, you'll withdraw from events or social activities, you'll isolate yourself, and that leads you on to being more negative about the situation. Then you focus on the things that have made your mood low, and you become negative about yourself. If you're anxious, you might avoid situations, you try and keep yourself busy, you escape from situations that make you feel anxious to try and keep yourself safe, and then that can distort your thinking about the world. And then anger is a similar thing, where you kind of look out for situations so that you'll hear something that triggers you to think about being angry, and then you get emotional, and then that'll have a physical arousal, so you'll feel all these different emotions and physical sensations as well. So then you can become defensive, and then you might get aggressive verbally or even physically at times. So those are just some ideas about things that you might notice. And again, this is just another image that shows some of those things. As psychologists, and people talk about cognitive behavioural therapy a lot of the time, so it's thinking about thoughts, emotions and behaviours and feelings, about how they all interact with one another. And, you know, none of these things happen in isolation. So you might have physical symptoms. If you're worrying about something, you might feel chest pains, or you might have more aches and pains or stuff like that. Behaviourally, if you're anxious, you might sleep less, or you might procrastinate about doing things. And cognitively, you might notice you've got poor concentration, or your memory is not as good as it used to be, and you're just constantly focusing on that worry. And psychologically, you might start to feel depressed or anxious or irritable. So all of those kind of things, just things to be mindful of and start noticing a little bit more day to day. And this is just a little thing about thinking about, you've only got so much headspace. So there's a thing like a bit of a buffer zone here. If you look at the diagram, you'll think that if it's a bit like traffic lights. So if you're coping well, you're in the green. If things get a little bit more stressful, you find it a little bit more difficult to cope. And when things are going really badly and you've got too much stress, it's a bit late then to start thinking, what can we do to manage that? We need to get you into a position where you're in that yellow level, so we can give some strategies that keep you in that, rather than tipping over into the red and into the really difficult stress zone. And these are just a few different things we can do to reduce our stress. So recognising the triggers, taking control of yourself. I mean, I'm not going to read out the whole list, but you can probably see that there are lots of things. People say exercise is quite good. And even with a neuromuscular condition, it's possible to do various different adapted exercises. So that's always really good to remember. And I think it's about not putting too much pressure on yourself, and thinking, actually, you know, I used to be able to do 10 sit-ups, and now I can't even stand up out of my chair, and how am I going to exercise? So I think it's about kind of changing people's thinking, and then thinking about, you know, there are different things we can use, you know, mindfulness, planning, One of the things I talk to a lot of patients about is being able to adapt and being able to plan, and that helps people move forwards. And obviously taking your own advice is a really good thing to do, and then getting feedback from people around you and asking them what they do to manage some of their stress levels. So I think this is quite a nice slide. It's saying the past is behind from it, learn from it. The future is ahead, prepare for it. And the present is here, live it. And I think, you know, quite often we don't live enough. And a lot of my patients I talk to about, you know, in order to you're going to be around for a lot longer. And if you can either stay in this position where you're miserable, or we can actually work together and try and change that, so you actually feel like you've got a really fulfilled life. And I think that's the aim of a psychologist, is to help people to kind of move towards living rather than just existing. And I think remembering, going back to the glass at the beginning, if you put it down, you'll feel a lot better. Don't hold on to it. Try and figure out a way of making things work better for you. So I said at the beginning, I was going to give you some ideas about where to get some more help. So even though you might not have a psychologist in the team that you go to see for your neuromuscular conditions, you can get psychological therapists through the NHS. And there's a video we'll show at the end, rather than coming out of this now. It talks a little bit about something called IAPT, and that's improving access to psychological therapists. So you can, when you've got sort of an illness, a long-standing illness, you can access that as well. And this is just there are a few links that you'll have at the end as well. Excuse me. Okay, and then there's also there's a self-help course thing that I've got, which I can show you as well, and that will be available to you. Excuse me, at the end. So locally, this is just Coventry and Warwick therapies, and this is a website where you can access this, and you can self-refer for if you're feeling down or you're feeling anxious. So that's just a little link where you can access psychological therapies. I often find that if you do have some psychological therapies, it might be useful to get one of your sort of medical people to talk to the person you're going to be seeing from the psychological therapist about your condition, because it might be they ask you to do things that you're not happy with, or you know, physically you might struggle with. So having a conversation with somebody who understands neuromuscular problems is really, really helpful. And I often find that if I refer people to other services, or you know, people are asking to help elsewhere, I will actually have a conversation with somebody around what it's like to have a neuromuscular problem, because obviously if you don't work within that field, it's quite difficult to understand what it feels like if you have a neuromuscular problem. So thank you very much for listening. I thought it'd be useful. We're going to have a little session in a few minutes' time just to talk about any questions you might have. But I think there's another video about IAPT, and again, I'm going to ask Nina if she can share that with you now.
I'm happy to do so. Just give me half a moment.
Hannah has dementia. Bernie, her husband, is her sole carer. They have the limited help of a support worker, but Bernie has become anxious and stressed. Naturally, he's worrying about the future. He doesn't want anyone to think he can't manage. He feels guilty about not being able to care for Hannah properly. He doesn't want to be a burden to his family, and he doesn't want Hannah to live in a care home. At a weekly lunch at the local dementia daycare centre, the coordinator notices that Bernie's been looking down and is often on edge. He asks if he's okay and offers his support. Bernie says he's fine, he's not depressed, just tired, and brushes it off as getting older. The coordinator, Dave, tells Bernie it's common for older people to feel depressed or anxious, and there is a talking therapy service he can go to. His GP has also picked up on Bernie's low moods and anxiety. He tells him that depression may not be about feeling sad. It could be feelings of emptiness or anger, or that things are hopeless. But it's not an inevitable part of getting older and can easily be treated. His GP puts him in touch with a psychological therapy service, also known as IAPT. If Bernie wants to think about it, he can call them direct without a GP referral. After a chat and a think, Bernie agrees to contact them. Simone, his psychological well-being practitioner, has helped Bernie to understand that being depressed is common and nothing to be ashamed of. 1 in 4 adults experiences mental health problems throughout their lives. Bernie's using some of the techniques he's learned in the IAP sessions, which have helped him to relax and sleep. He's working things through and feels less worried, more hopeful, and he's out and about with Hannah and with other carers. He enjoys spending time with people who understand how he feels. Talking therapies help people with common mental health problems. The service can also help people who experience low mood or anxiety as a result of managing a long-term health condition, such as diabetes or heart disease.
So I think that was just a helpful sort of video just to let people know that you don't have to be an old person, but you know, it's there for everyone.
Everybody to Public Board, NHS England. The session again will be live streamed, and we have members of the public.
Sorry about that.
It's okay. So yeah, I think it was just a helpful way of describing what happens with IAP. So it isn't just for old people, it's for everyone, and you can access that. And they put some links into your local sort of Coventry and Warwick services, so you can look at that as well. But again, there are a few other links in the presentation which will be available. There's also there's a document as well. I'm not sure whether I can share the document with you. Let's have a quick look. I don't think it's going to allow me to share it, but I can put it into a chat as well, or it's actually available and I can send that out to you. Okay, so that's pretty much the end of the talk, really. So I guess if people want to ask questions, this is a good time. Thank you for listening. That's great.
Thank you so much, Yvette. That was really insightful. In terms of all the resources, I have got the presentation and I will share the presentation and all the resources within with every attendant tomorrow. In an email, I will also send you a link to the presentation so you can go over it in your own time again if you want to. And Yvette, if there's any other resources you would like to share with us, just send me an email and I'm happy to share them with all the participants.
Okay, brilliant.
Tomorrow in an email.
Yeah, okay.
And yeah, I'd like to open the floor to any questions. You can either unmute yourself and ask a question or start a discussion, or if you feel more comfortable, please do send me a direct message in the chat option and I'm more than happy to ask a question for you. I will also stop the recording as of this moment.